And welcome to Duke Spine Institute. I'm Dr. Duke Majin. We are going to be performing our final surgery for September 11, 2025. Our patient, she's young. She's 20, in the mid-20s. She comes from Washington, Olympia, Washington. Traveled across the country for the laser surgery because she is young. She doesn't want to have invasive back surgery. She doesn't want laminectomies and removing bones and ligaments that she needs in her spine. So she chose the Duke laser disc repair. Go ahead. As we perform her Duke laser disc repair surgery, feel free to ask questions. I'll do my best to answer them for you. Why does it seem like Mount Olympus is here? Is she like tilted down? Because it seems like we were in Trendelenburg or something. No? The feet are not higher? Ah, okay. All right, then let's get started. We're going to put just a little bit of numbing medicine here on the skin. We're going to be on the left side. She has horrific left leg pain and back pain. What is shaking? All right. All right, if you have questions, feel free to ask me. Otherwise, I'm going to get started. Now, one thing I noticed, she has a pseudo disc, and let's talk about what that is for a moment. But I'm going to have Jordan show us the pseudo disc shot. The pseudo disc means fake disc. There it is, right there. It's embedded in the sacrum. It's really between S1 and S2. Show us the disc that is our target. That's correct. That's the L5-S1 disc. Where is the herniation? It's in the back of the disc. Show us the front of the disc. Front. Show us the back of the disc. Back. There's a tear shot, and there is a herniation right there. All right. Well, let's get started. In the meantime, Henry, let's show the audience the 30 different things that cause back pain. I'm Dr. R. Duke Majin with the Duke Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Duke laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Duke plasma rhizotomy of the SI joints offered at Duke Spine or Duke Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Duke piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Duke Machen. Thanks for joining us. And welcome back. So this young lady has a herniated disc at L5-S1. She's young. She's only in her mid-20s. Folks, disc injuries happen at any age from birth until 99. And we always think of disc problems being the problem of older people, but it's not. There are young people that suffer from back pain from a disc injury, or leg pain in her case from a disc injury, and they need treatment. And unfortunately, a lot of doctors just blow these people off and tell them you don't want surgery, you're too young, but surgery is exactly what they need. All right, there's a little piece of herniation there. We're just going down the tube and we're going to keep pulling out as much of that piece of herniation as we can get out. So that's really what this is about. And we got the 30 causes of back pain already. Yes?
Yes, we did. Correct.
Why don't we show the audience how disc injuries can cause back pain?
Of course.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. So you can see from the video, that's a piece of herniation right there. You guys see that thing that's floating up?
Yes, we do.
Now this piece of herniation I'm working on right now is actually scarred down to the back of the disc from scar tissue. That scar tissue comes from what's called inflammation. And you don't get scar tissue when you have inflammation for just a few days. You really have to have inflammation for a long time. Generally, you need years of inflammation to get really thick scar tissue. Now, we were just talking about greatest comedian of all time. And We had one person say Richard Pryor. We had Eddie Murphy, George Carlin, Chappelle, Andrew Dice Clay, but still, Chris Rock, but still there's a few comedians that have been left out. Luis? Chevy Chase. Brilliant. We have a Chevy Chase. Yes, I think he's one of the best. Who else?
Oh, Chris Farley was amazing.
John Candy.
Robin Williams.
Robin Williams, one of the best in the world.
Oh, Rodney Dangerfield.
Rodney Dangerfield, yes. We're getting some great names. Jim Carrey.
Jim Carrey.
How can we forget Jim Carrey? Adam Sandler is good. And who else? Bill Murray.
Bill Murray.
That's right.
And that was all improvised. Caddyshack was all improvised by him.
Yeah.
I watched the video on that,
Yeah, Bill Murray, one of the greatest.
Oh, Bill Hicks and Sam Kinison.
Yep. Dan Aykroyd.
Dan Aykroyd.
How about
John
John Belushi?
Belushi. The Blues Brothers. How can we forget Belushi? Was it Animal House?
Animal House, correct.
And the Blues Brothers.
We had Jason on YouTube comment Jimmy Carr.
Jimmy Carr. Thank you, Jason. Very good.
How about the White guy?
Who?
White, his last name was White, Roger White, or
White? I don't know that guy. Do I know him? I'm not sure.
drink in his hand, gray hair. Ron White.
Ron White.
Ron White.
All right.
I love him.
And of course, that reminds me of Ron Burgundy. Right? Will Ferrell. Great. We have some great names. How important is comedy?
Beyond important.
Dana Harvey. Dr. Berndes added in Dana Harvey. Okay, we are literally, all this stuff I'm using the laser on. This is the laser, by the way. It's about 1 millimeter wide. You could see the tube from side to side is going to be about 5.5 millimeters. But this is the herniation. That's what I've been using the laser. And for those of you who are new to this, the laser is so good at removing things. Look at that. It just disappears. And the reason it looks like it disappears is that the laser discharges, this fiber discharges very powerful energy. It's invisible to your eye. You cannot see it. And it literally gets absorbed by this herniation, and it blows the herniation up into thousands of little pieces of tissue because it breaks what's called covalent bonds between these proteins in the herniation. So this laser energy is used to disrupt bonds, chemical bonds that hold tissues together. And that's why things just disappear. And then of course we have irrigation, which is a fluid circulating in here. And that fluid removes all the pieces of debris. Watch what happens when I shut off the fluid. Okay? And now I'm going to create the debris. You see the debris?
Yes, we
because
do.
I'm not removing it, it's just floating around. So by turning on the irrigation, I'm going to get rid of it all. There it goes. It's gone. So having irrigation is very important. Oh yeah, and some of you have seen my irrigation video. Oh, that went viral. All right, look at the pink tissue right there. You see that?
Yes, we do.
That is inflammatory tissue right there. It's inflammation inside the annular tear. That is exactly what causes the back pain. Any questions from our audience?
Yes, we have about a question and a comment, and we're seeking advice. The question coming from Lanu on YouTube,
Oh, hi, Lanu.
asking, Japan has tons of medical dramas and movies every year. Why is it that America has so few medical movies or dramas?
Great question. Maybe it's because people are basically I don't think they find the healthcare system something that they can joke around about or take lightly. It's something that is really bothers them, and maybe they're just having trouble. They don't want to be reminded about how bad our healthcare system is. So maybe that's why they don't like medical dramas, you know? Because it kind of draws your attention to the fact that our medical system sucks so bad right now. We're like number 64 in the world. We used to be number 1, and people don't want to be reminded about it. Maybe because going to the doctor in America these days is so traumatic for patients, having to wait in the waiting room, having to wait to get an appointment, having to deal with their insurance company denying their office visit or treatment, not paying for it. You know, maybe insurance is just something that really angers people, and they don't want to watch a program with insurance, with the medical, you know? Maybe that's why. I don't know.
Can I say something on this?
Yeah, of course, please.
I feel like, from my perspective, is that we've done almost every type of medical show that you can possibly think of. Is that when coming up with new ones right now, it's when it comes to originality and uniqueness, is you want to get over that hump rather than for it to be bland. So therefore, like Scrubs, House, The Good Doctor, Grey's Anatomy, you know, all those medical shows happened. You know, putting them in today's medium with, you know, how today's culture is, it just would come off as cheesy, cringe, and all. But there is a new show that is out that just renewed for 2 more seasons called The Pit, and it's about an ER hospital in Pittsburgh, and each episode represents 1 hour of a 15-hour shift. It's 15 episodes.
All right.
And I cannot recommend anybody. I can't recommend that show enough. It's an awesome show, very intense, and it gives a huge, bright idea of the medical industry in the U.S.
I thought you were going to recommend Spine Scam, the movie.
And let me say this. Someone did, that was the next question. When is your Netflix documentary coming out, coming from Jamie? And I did put the link for Spine Scam on in the chat.
So Jamie, the documentary is out. It's a docudrama, not a documentary. We had to make it kind of interesting for people rather than a dry documentary. And the docudrama is out. We put it on YouTube. We decided to make it free to everybody because not everyone has Netflix. And, you know, a lot of people have left Netflix. So the question is, what is the best streaming service? We don't know anymore. It could be HBO, it could be Netflix. But honestly, the best streaming, if you want to get something out for everybody to see for free, is YouTube. So that's why we decided to YouTube it. We felt we would reach the most people with YouTube and make it free for everyone. So it's out. All you got to do is go to the Spine Scam YouTube channel and watch the movie, and it's free. Now that is the first movie. If it is successful and we get enough people watching it, then we are going to make more movies in the series. But we've got to get some revenue generated from that. Okay, look at that. Look at that inflammatory tissue right there. This is the annular tear that allowed the herniation to come out, and we are removing a combination of herniation and torn annulus. But this is all right here, herniation. So I'm shrinking down her herniation. And when I get it small enough, I'm going to be done. And she will heal this thing up herself over the next 12 months. You can see a little bit of yellow stuff there. That's calcium. And the reason there's calcium here, there shouldn't be. In a normal disc, there will not be this calcium. So calcium comes when you have chronic inflammation. So this disc injury is probably several years old, at least several years old. It could be older. And the more calcium we see, the older the injury is. I think this injury, to me, looks like it's about 5 or 6 years old, if I had to guess.
We have a comment and or seeking advice coming from Jason on YouTube.
Sure.
saying, "Hi, Dr. Duke.
Hi.
Went to a specialist this week. Even though I have 3 bulging discs, he said for a 47-year-old, my back doesn't look too bad. So I left still in pain, been this way for 3 years. I have even lost bladder control a couple times while asleep.
Jeez.
Going to a second opinion. I'm not imagining this."
Yeah, I know. I'm so sorry to hear that. Unfortunately, you've run into one of the burn discs. Mueve. You've run into one of the most common problems that we have in healthcare in spine, and that is that doctors, what's the 100 up there? Heart rate?
Oxygen saturation.
Oh, 74. Doctors that look at an MRI and see bulging discs that are small make their decision based on the MRI scan. They don't make their decision based on the patient's quality of life or suffering. So what they say is your disc bulges are small and very common for your age, and you don't need to do anything about it. But what they're not taking into account is the fact that you can do something about it. They just don't know that something can be done. So what you should tell your doctor is, well, doc, send your patients with bulging discs and back pain to the Duke Spine Institute. They will fix their pain. That's the best thing you can do with that doctor, to educate them. Very common misconception in our world of spine care is that the patient's symptom is proportional to the size of the herniation, and it is 100% wrong. All right, we're just about done here. I've got about 1 minute left on this disc, and then we're going to move to our piriformis. Any other questions?
Yes, we have a question coming from Adrian on YouTube,
Yes, Adrian.
asking, "Are insurances covering this procedure now?"
Yes, some insurances will cover this procedure, others will not. Not every insurance covers the Duke laser disc repair. Okay, we're done. I'm going to just reach in one more time. We'll be back in just a few minutes with our piriformis release on the left side. This young lady has been suffering with pain in her back and down her leg for so long, she actually bent over and tore her piriformis muscle, accidentally, of course. Very common problem in people with chronic back pain is that they don't bend properly, and as such, they can injure other parts of their body. In her case, she injured her piriformis muscle. So we're going to go in and do a piriformis release on the left side. Thanks for joining us. And Henry will leave you with one of our patients that we've treated in the past. Come on back in a few minutes and we'll be doing our piriformis release. I'm Dr. Duke Machen, CEO and founder of the Duke Spine Institute. I have a patient with me who just had the Duke laser disc repair less than 24 hours ago, about 12 hours ago. And here you are. How do you feel today?
I feel better than I have in probably half a year, I'd say close to 5 or 6 months. It's one day after and time will tell, but I didn't think this was possible this quickly.
Yeah, time will tell. We've done now 2,200 of these surgeries with the laser endoscopic. Consistently, the pain is gone. It's permanently gone. It never comes back. And so I'm excited for you that you're gonna do fantastic. Now, you live about an hour away. How did you find out about Duke Spine Institute?
I got a referral and noticed that it was only an hour away, so made my way up here, and the first time I came for a visit was kind of felt like home, kind of felt like where I should be anyway, so that kind of fit right into everything this far. So
You had, was it back and leg pain, correct?
back pain a little bit, but my biggest issue was shooting down the leg pain. It was numb all the time for about 4 or 5 months on and off, so didn't know what else to do, and this was the right choice, I would say.
You came to us and we found weakness also. You had weak pulling your toe up. That's because the nerve was pinched so bad at L5-S1. You can see here on the video, we went in with a tiny Band-Aid incision, 1/4 inch. We went in and basically removed most of the herniation, cleaned up the tear where it came out of so that the tear will now heal. Your disc will heal naturally. And we did it all without removing bones or ligaments. If you had had a microdiscectomy or laminectomy, which is what every other surgeon offers, because they don't